Hey guys, welcome. This is Dr. Dilip, your internal medicine faculty at Cerebellum Academy, and today we have one of our esteemed students, Dr. Priyanka, who scored a fantastic rank of 259 in the NEET PG 2024 exam. And she was a pretty much consistent performer though, and she scored a very good rank of 524 in the INI as well. And let's welcome Dr. Priyanka.
Thank you so much, sir.
And how do you really feel about this?
Sir, it was an absolutely surreal feeling. I cannot explain in words because it was like out of the blue that the result came. And then there was this link not opening and all of that, posh, posh. And finally, when it opened, and I could not believe my eyes, I just saw my roll number and I was rechecking it. I made my sister check it. I made everybody in my family check it. This is the score. This is the score, right? I got this rank. And then they were like, yeah, finally. And after 2 days, it finally sinks in that, okay, I got this rank.
Yeah, it must be a great feeling. And I mean, considering the fact that you guys have gone through a lot till this year's NEET PG, I mean, a lot of postponements, a lot of other issues, and one of the toughest NEET PG exams everyone has ever faced. In terms of not only the logistic issues, in terms of the papers as well. Like the papers were also quite tough. It's been quite clinical, and yes.
It was tough.
Yeah, I mean, coming to the original part of the discussion, and like, how did you really prepare? I mean, because this is a question that I tend to begin with every single topic, because each and everyone has their unique ways of preparation, and they tend to give something to the juniors generally. So that's why I want to know, like, how did you really prepare and how did you go about it? And I think you finished your internship last year by September.
Yes, sir.
Not wrong. So from there on, like, how did you take it? When did you start your preparation? You can start from there.
So I started my preparation somewhere around November. After the INI-CET last time, I knew I could not give that last time. So I thought, let's aim for the March exam. So I started from November and I followed your Cerebellum 1.0 mission classes. And I found that very elaborate because it was not as bit concise as rapid revision, but it was not as detailed as main videos, but it was sufficient. It was what was actually, I think it was so elaborate, there was no need for us to do anything more than that. After that, somewhere around January or February, I started doing BTR, and then I supplemented my quick revision notes with my BTR notes, and I would do many cycles of that. Once I finish once, I would review that. And I think the revision was the key that actually was very important. Every time I revise, I learn something new.
True. Absolutely. And this is something that every single candidate has told me, like whoever are the toppers, like maybe the top 500 or top 600, everyone has told the same. They have done either a mission or a mission plus QR, but I mean, at the end, they've supplemented with BTR as well. So either like 2 or 3 of whatever that is there available in the Cerebellum. So that's what they did. And they have been like getting consistent benefits in the GETs as well as that translated into results in the exam as well.
Yes, sir. So especially that the last month ENDs that were conducted, that is very good. I absolutely found it very helpful because
there are 2 things that we felt are going to be very useful to students. One is the last month ENDs, as I told you, and then we have even done the late night PYQs.
Yes, sir.
If you remember.
Yes, sir.
Especially the late night PYQs.
During INI-CET, I felt many questions were from that, direct repeats, and it was very good.
Yeah, and even we did the marathon sessions. I think, like, I mean, we did do like 2 to 3 marathon sessions because the exam kept on getting postponed. But even those marathon sessions, people have been saying like they were quite useful.
Yes, sir. I found it personally very useful. So it was very concise and it was doable. In the last moment, it does not pressurize you more. It just like, you know this. It just gets you along.
Yeah, it's just a kind of a very, very rapid and like very fast revision in a single day. Like you can revise like 1 or 2 subjects in a single day. And what we felt will be useful for the students is that even bullet points that we discussed in the last, like 2 weeks, couple of weeks before, I think, before the NEET exam. So even like just one-liners, even though they can be called as one-liners, but actually they are the core points that you need to answer in the exams.
So for anybody who's preparing in the last 1 week, if they want to do something, that was gold. That was what they needed to do. And many from that.
As faculties, like even we felt really good for two reasons. One, of course, we got like tremendous results this year. As a faculty group, as a whole in Cerebellum, we are like very, very like happy and pleasing. And the second thing is like through the groups, we are able to connect to the students directly. Most of times, like that's what pleases us even more. So like we can speak to the students. Even some of the students directly message us. They tell like what they are going through, even some of the family problems, like whatever the personal issues. When we have been discussing all of these things, and finally, when we come to know that a candidate has performed well and he has got a good rank, and that's what one of the good feelings for any faculties. I mean that's what we have been even talking.
Yes, sir. It's
As a
actually
whole.
you are just one message, literally one message away, and that is like that gives us a very good feel that whatever may be happening, if you have a doubt, you can directly ask them. There is no scope of a doubt anywhere.
Yeah, that's absolutely true. And even we are like more than happy to help the students. Like we make sure that we don't even miss out on a single question every time when somebody tags. Even we are in quite a hectic schedule. Even in between the classes, when we see somebody has tagged us, we tend to always reply. So to our best of our knowledge. And I mean, anyways, like we are more than happy that it has helped you a lot. And I just want you to know like your preparation strategy in the undergraduation, because when you wanted to score a consistent rank like this, like the two very good ranks in both INI as well as NEET PG, you should have done a lot of hard work in your undergraduation as well.
Yes, sir. But I would not say that I was the topper. I was not a topper. I was like somewhere around the average scorer only.
Come on, man. That really doesn't matter. So what you're right now really matters.
Yes, sir. But absolutely. So it was. I did considerably well in like during my prof.
Okay, so you just did the usual prof kind of preparation,
Yes, sir.
and the preparation started only after September.
Yes, sir.
For the entrances.
Yes, sir.
Fantastic.
Mhm.
And I mean, how did you really feel about the GTs? I mean, why I want to ask this question is because there are like a lot of students, like maybe 80-90% of the students who have spoken. So who used to tell like the GTs were like kind of very intriguing. It was not too tough. It was not too easy. So, I mean, how did the GTs boost your confidence?
Sir, what I feel in general is that GTs, I used to focus on one thing, that even in the worst of my days, what is the maximum or the average that I can score? And that was the average that I want on the day of examination. I don't want my score to be absolutely low. I don't want it to be high. I want it to be an
Interesting.
average of whatever.
Nice. Yeah, this
Yes,
is
sir.
something different I got from you. Yeah.
So yes,
Good.
I personally I used to score at somewhere around 140 corrects before INI-CETs. So I wanted to maintain it at that, so that even if my worst performance would be 140, so it wouldn't be below that. And that is what I took to NEET PG also. I didn't want the GTs are not about the score. It is just about like how you can assess yourself, and you have to look back how you could have done, what the silly mistakes you're doing, how you could have done those right. That is what is important in GTs. Other than that, regarding cerebellum GTs, the last two GTs especially were very good. I think that it was very, very close to NEET level.
Yeah, people think they were easy, but they were not. Like we have said a lot of tricky questions in those GTs, especially the INI GT and the GT that was conducted just before the NEET. Like they were like quite tricky. They were not like easy GTs at all. When we try to set medicine questions, for example, like we wanted like the students to really have a challenge at it and a crack at it.
Yes, sir. So because even in the NEET PG exam, sir, there were certain questions which were from the topics, but they were not the exact topics that we are used to. They were like extrapolated from that topic only. So it tells us that PYQs are important. It's not exactly the PYQ. So the more we do, the more it sounds similar. We will think that yaar, ye ho jayega. But it may be little bit different, because that was
True.
the case in this NEET PG. Because
No, of course, that's what we have been even emphasizing in the mission classes as well. When I've been taking the mission classes, even the QR, if you look at it, we always have been emphasizing on the topics rather than the exact PYQs themselves. So, and
yes,
many students have even like texted us saying that the mission classes are a constellation of the topics rather than just the PYQs.
yes, sir.
And we have potentially even covered the possible like questions that could be asked in the future exams,
Yes, sir.
if you remember. And Priyanka, what's your aspiration? I mean, what's your dream branch?
Sir, I think I would like to take dermatology as a branch, but now I am considering it so that I can do a deeper research on that, and then I will decide whether I want to take it or not. But for now, I think it is dermatology.
Okay, if you don't mind, should I ask why? Why
I don't,
dermatology?
sir, I don't want to do night duties.
That's a good one. Yeah, that's okay. That's completely fine. That's all right.
Yes, sir, that's why.
Well, so you have not yet decided your field, right?
Yes, sir.
Okay. So anyways, all the best for your counseling. You'll be doing well. I think by then you'll be having a clear idea about what branch to choose and what not to.
Yes, sir.
But anyways, you'll be having a lot of people to discuss with you as well.
Yes, sir.
You already started the process?
No, yes, sir. I've started like a few people I know, so I'm just starting to ask them, and my seniors who have taken up, so I'm asking them.
Okay. So there are some couple of rapid fire questions for you.
Okay, sir.
So and you have to be very honest with it.
Okay, I'll try, sir.
Yeah. Question one. Who are the favorite teachers?
Zainab Vora ma'am and you, sir. And Sparsh, sir. And
And of
Sparsh.
course, you will not tell because I'm taking the interview.
No, sir. No, sir.
You can be honest, really.
Really honest, sir.
Okay, so you are honest. Okay, fine. Let me be happy about it. So question number two. How many revisions did you really do? Honest.
At least 7.
7? Really?
Yes, sir.
7 revisions. Great. Okay. Question number 3. Another rapid fire. How many GTs you did?
I think 10, 12.
Combining everything. Whatever GTs. Leave the Cerebellum GTs alone. Every single GT, whatever you did so far.
Near about 10 to 12.
That's it. Okay. So because some people say like 25, 30 GTs, that's why.
No, sir. Actually, initially, I did not have so much confidence that I can give the GT well. And then later on, when I started, so I had a considerable gap between giving them. So I think on an average 10 to 12. Yeah, that is the same.
10 to 12 GTs. Fourth question. How did you find medicine to read?
Sir, to be honest, I thought
Because this question, because every single student keeps asking in the group. Because like, I mean, obviously I'm a medicine teacher, I'll be biased towards medicine. So every single student like keeps asking the same question. Should I read medicine? And how much should I read medicine? Like whether I'll be able to read medicine or not. That's why I'm asking this question.
Yes, sir. Initially, I found medicine very difficult, and then I started doing your classes. And then when I did PTR, actually it became a little bit more simplified. And then I came back to your classes. So that is the time when I actually got everything together. And then it became easier. I'm not saying it's easy, but it became easier.
It became easy.
Yeah, for me it was biochemistry. I did not like biochemistry. I had to sit down with the main videos, and I did biochemistry like that.
I mean, being a teacher, I should not comment anything on any subject because even I felt biochemistry very, very tough and very, very weird during my preparation time as well. But anyway, it's natural that you feel the same way as well.
Yes, sir.
Okay, fifth question. Doing medicine, did you find it useful?
Yes, sir. Especially, I would say my favorite class would be the HIV and TB class, the extra advantage classes. Like I absolutely love those 2 classes. It is so detailed, and like there are many times that our minds won't go to those places where you have taken us in those classes, like very minute things that we may miss out, and then it just strikes you like a eureka moment.
Yeah, I mean, the medicine classes are all about like your common sense, I would say. So like you don't want to miss out, and you want to start thinking like a consultant. I mean, that's what I wanted. Like I don't want you to think like a NEET PG aspirant in the term of MCQs. Once you start thinking as a consultant, like the questions become very easy because that's how the questions will be framed anyways. Because now the questions are going to be extremely clinical, and you have to always think about what next, what best, and what should be done for this patient. And logically speaking, like if you come to the hospital, like this is what we are going to do. Like the exact same pathway. Like that is the reason like why I tend to discuss medicine like mostly flow charts and tables, like so that you can just follow a process and apply that in exam. And the same process you're going to apply in real life as well. Nothing more.
Yes, sir.
And anyways, like I wish you will be in some of the clinical. I mean, dermatology is still a clinical field, but because like you are a very enthusiastic student and you tend to keep answering questions so much in exams. I mean, in the mission classes and as well as in the ENT discussions, I wish that you really become a physician.
I'll consider, sir. I'll consider.
No. I mean, it's not like an obligation. Like it's just a request because you're such a brilliant student. I mean, as far as I know, and there are much more brilliant students out there. And because your logistic thinking capability is also very good, because many times I've seen like few students, maybe 10 to 15, who tend to like really make me feel, wow, like these candidates are really going to like have a good exam, good NEET exam or good INI. So you are one among them, because I know your nickname also. Yeah, in the mission classes and in END discussions. But anyways, like that's why I wish, like there are certain students who I really wish like they become physicians, because you guys have a tremendous like logistic thinking and the lateral thinking ability. That's what we really require in medicine. And thank you very much, Dr. Priyanka.
Thank you, sir.
Thank you so much again. And we, as a part of Cerebellum, like we wish you all the very, very best.
Thank you so much, sir.
Thank you for making us proud.
Thank you.
Yeah. See you on the other side. Bye-bye.
Bye-bye, sir.